Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. Then we have to see esophageal constrictions. In the esophageal constrictions, esophageal constrictions are present at three positions. Okay. That is, we have to see the distance from the incisor teeth. If the esophageal constrictions, if they are present at 15 centimeters, actually first constriction is present at around 15 centimeters from the uh, it is present 15 centimeters from incisor teeth, and it is present at C6 level, and here we see pharyngoesophageal junction, or it is seen at the beginning or at pharyngoesophageal junction. So first constriction is present at C6 at 15 centimeters distance from the incisor teeth, and it is present at the pharyngoesophageal junction. So if this is the pharynx and this is the esophagus, you see the first constriction at pharyngoesophageal junction, which is around 15 centimeters from the incisor teeth. Then we have to see where is second constriction present. So second constriction is actually present. Second constriction is present at around 25 centimeters from the incisor teeth, and it is at the aortic arch and the left bronchus, and it is present at aortic arch and left bronchus. So if this is the aortic arch or this is the left bronchus, that is when you see the secondary constriction is present. So this is present at around 25 centimeters from the incisor teeth. So this is second constriction. Then we have third constriction, which is present at 40 centimeters from the incisor teeth, and this is present at T10. Okay, this is present at 40 centimeters of incisor teeth, and it is present at T10, and this will pierce the diaphragm. This is present at the site where it pierces the diaphragm. So if this is the diaphragm, at the site where it pierces the diaphragm, we see the third constriction, which is around 40 centimeters from the incisor teeth. So these are the three constrictions of the esophagus.
thank you and thank you for watching.